Great Plains Laboratory, GPL, is located in Lenexa, Kansas, in the greater Kansas City area. Since opening our doors in 1996, we have become a leader in research-based biomedical laboratory testing. We are a global company working with physicians and patients in over 100 countries. Our website and educational materials have been translated into 8 different languages, including French, Japanese, and Spanish. Our International Operations Department is able to help with any problems, including customs, regulatory agencies, and general support from start to finish. Our goal is to have no borders when it comes to improving people's quality of life. The comprehensive biomedical testing we offer aids practitioners seeking underlying causes of chronic health issues that routine lab work often fails to identify. Our laboratory tests food allergies and sensitivities, nutritional deficiencies, inflammation, markers for neurotransmitter imbalances, toxic chemical exposure, and immune dysfunction, as well as intestinal issues including digestive disorders, dysbiosis, and microbial infections. Once identified, many abnormalities may be mitigated, and the symptoms of many chronic illnesses can be decreased or even eliminated through the targeted use of nutritional supplements and dietary changes. The Great Plains Laboratory has tested and helped over 200,000 patients with a variety of chronic disorders, including depression, obsessive-compulsive disorder, eating disorders, bipolar disorder, schizophrenia, fibromyalgia, autism spectrum disorders, chronic fatigue, multiple sclerosis, and many more. Our laboratory director, Dr. William Shaw, is a biochemist with board certification in clinical chemistry and toxicology. Before he founded the Great Plains Laboratory, Inc., he worked for the Centers for Disease Control and Prevention, Children's Mercy Hospital, the University of Missouri at Kansas City School of Medicine, and SmithKline Laboratories. He is also the author of Biological Treatments for Autism and Ph.D. and Autism Beyond the Basics, both of which are available on our website. He frequently speaks at conferences worldwide to help educate patients and medical practitioners on how to successfully find and treat underlying issues contributing to autism, ADHD, psychiatric disorders, Alzheimer's disease, fibromyalgia, and other chronic diseases. He is the stepfather of a child with autism and has helped thousands of parents and physicians successfully contribute to improving the lives of children with autism.
I got the idea from the laboratory while I was working at the Children's Hospital. And the Children's Hospital, I did many tests for a analytical method called organic acids. And at that time, what I discovered was there was no underlying genetic disorder, but what I found was a number of compounds that were due to abnormal microorganisms in the intestinal tract. And focusing on that became extremely important and led to the treatments for a lot of children that previously were not treated for this.
One thing I always say is I probably wouldn't be in business if it wasn't for Great Plains Lab IgG testing, because it truly has helped so many of my patients.
I've been doing Great Plains laboratory testing on my patients, both children and adults, for several years now, and it's been an invaluable part of my assessments of all different kinds of conditions.
Now, Great Plains offers a number of different options for insurance reimbursement, and their tests are actually covered by a number of different insurance companies. So I'd encourage you to contact them directly to find out about your specific or your child's specific insurance coverage.
The Great Plains Laboratory strives to build strong relationships with our clients. We have established a committed and knowledgeable team of support specialists to assist our clients every step of the way. A dedicated account representative is assigned to each new practitioner to provide support, training, and guidance throughout the testing process, and our professional customer service team is available to answer client questions and take kit orders. Clients may order test kits by phone, fax, or through our website at gpl.com. 4u.com. Once orders for testing kits are received, our shipping department makes sure the kits are mailed in a timely manner. The Great Plains Laboratory never charges for kits sent within the United States. Our knowledgeable billing team can help answer any insurance or billing questions clients may have. We work with many insurance carriers, including Blue Cross Blue Shield, TRICARE, and Medicare.
The Great Plains Laboratory is certified under current federal regulations to perform high-complexity and laboratory-developed tests. As a result, regular inspections ensure that our laboratory operations meet the standards of quality and personnel qualifications. Furthermore, we participate in external proficiency testing offered by the College of American Pathologists to periodically evaluate our laboratory procedures and ensure accuracy of laboratory results.
The key benefits of these coordinated activities translates basically into rapid turnaround time, lowest cost possible for the client physicians, and the ability to be responsive to different changes on customer needs.
We would like to invite you into the laboratory for a quick tour so that you'll have a better understanding of sample processes for a few of our core laboratory tests.
Each day, the Great Plains Laboratory receives hundreds of urine, blood, stool, and hair samples that are shipped overnight from all over the world and delivered by FedEx, DHL, and the Postal Service to our Specimen Receiving Department. Here, every kit received is carefully checked to ensure accuracy and sufficiency. Samples are then accessioned, aliquoted, and separated into racks and bins to be delivered to the various workstations within the lab. The test requisitions are sent to the Medical Records Department for data entry and to be scanned into archives. When we receive samples that are insufficient or have omitted patient or sample information, we have personnel to contact the patients or physicians to resolve the situation and move these samples into processing, or as necessary, request a recollection.
Following the samples to the laboratory, let's begin with the organic acid analysis. The organic acid process begins with a liquid-liquid extraction of the urine sample, followed by derivatization, with analysis by gas chromatography and mass spectrometry, or GCMS. The sample is injected into the GC, where the analytes are separated by the column. As the molecules exit the column, they are ionized and detected by the mass spectrometer. The signal is collected by the software and stored in the patient's data file. Experienced data analysts review the chromatograms for correct peak and spectrum identification and to rule out interferences, thus eliminating false positives and negatives. Once the results have been reviewed and verified, patient results are pulled into a categorized report. The profile includes 74 markers associated with dysbiosis, glycolysis and Krebs cycle metabolism, nutrition, and genetic inborn errors of metabolism. Genetic disease is typically identified in infancy, but because we service a large international market, we've been able to identify previously undiagnosed genetic disease in samples from countries where infant screening for organic acids is not routinely practiced. We also offer specific IgE testing for many foods and inhalants. This test is to help diagnose immediate food or inhalant hypersensitivities and is performed on a third-generation automated instrument. Serum is incubated in tubes containing discs embedded with antigens, then incubated with a solution containing a detecting enzyme that recognizes human IgE. The addition of a substrate to the bound antigen IgE complex results in an enzymatic reaction forming a color change, which is then read by an optical density reader. The optical density response from each food is extrapolated to a series of human IgE calibrators to give the final concentration of specific human IgE for each antigen. Moving on to our food sensitivity testing, the CompFood IgG test is an enzyme-linked immunoassay. Microtiter plates are manufactured in our facility, coating the wells with highly purified food antigens. Our stock food extracts come from FDA-approved facilities that have optimized the conditions to extract the allergens from foods for skin prick testing purposes. Patient samples are applied to the plates where sample IgG antibodies interact with the antigen, followed by an enzymatic reaction that results in a color change. The optical densities are analyzed and the results are reported as a ratio-based index of the antigen response over the background. This test measures antibodies to 93 common foods and Candida albicans. Elevated levels identify sensitivities that contribute to migraines, obesity, and chronic illnesses such as irritable bowel syndrome.
All of these activities require oversight to guarantee the quality of service through monitoring quality assurance and quality control specifications. We want to ensure our clients receive the best quality possible. Maintenance and calibration records are maintained for all equipment and instrumentation. Once test results are available for review, the quality assurance staff carefully examines all sample testing batches to verify that QC measures are within instrument and assay specifications.
Verified patient results are received by the Medical Records Department, where patient demographics are reviewed for accuracy. Patient reports are sent to practitioners and patients via secured email, fax, or mail according to the physician preference.
Before we let you go, we want to share with you some additional resources that our laboratory has to offer. Complimentary 30-minute phone consultations are provided by a nutrition specialist who can help physicians and clients better understand their test results. Dr. Shaw is also available by appointment to help practitioners go over difficult patient cases or for practitioners who are new to our laboratory. We also offer an online portal called Results Plus. Here, practitioners can access test results, send test kits directly to their patients, order test kits for their office, access the most updated clinician manual, and update account and billing information. Training materials and resources are also available for clients, including physician and patient packets, clinician information manuals, informational testing brochures, conference training DVDs, as well as books, which can be found on our website and our bookstore. The Great Plains Laboratory also sponsors several conferences each year in addition to exhibiting and speaking at conferences around the world. We also host free educational webinars each month on a variety of topics and have numerous recorded webinars and videos available on our website that can be viewed at any time. To receive details on upcoming webinars and events, along with other pertinent research information, join our e-newsletter today.
Thank you for your interest in the Great Plains Laboratory. I think there's a lot of useful information you can get from this company with its testing, and all our employees are dedicated to helping the people who need to be helped, and we're all available to help you with understanding the testing and making it more valuable to you and the families who rely on you to get treatment.
Thank you for taking the time to learn more about us and our mission. We look forward to serving you in the near future.